I call our biomed unit, I call it purgatory, because all of our machines just go there after they've died to wait to see whether they're going to heaven.
Technology also refers to equipment in hospitals.
Yes,
right?
that's very much.
And this is one of the areas that I do have concern about, and I'm sure everyone would. Minister will tell you that one of my pet projects is dialysis, the provision of dialysis units, and it is my view that with the burden of the NCDs and its effect on renal failure, and the requirement for more people to have dialysis, that we should have at least one attached to each regional hospital, dialysis unit attached to each regional hospital initially before it can be expanded, until the program that the lifestyle changes will catch up to reduce that. Secondly, I would have hoped that the minister spoke to the deficits in the hospitals now as it relates to functioning of the CT scanners, the X-ray units, and those ultrasounds. I know they've gotten in terms of donations and gifts, but we still have major hospitals which do not have the major facilities operational. Say, for example, Congo Regional, which needs a good X-ray unit, that doesn't go. We have portable ones there being utilized, but the main one doesn't allow. It's not being used. The smaller ones don't allow for the detailed studies that you have, so that we set outside under the public-private partnership program. So, yes, we need some more. The minister mentioned that as well, to be fair to him.
Yeah, so we're looking at leasing as opposed to purchase. I agree with my colleague that the equipment is there are four planks to the build out, to the renewal of the health system. One is the hard infrastructure, the buildings. The other is equipment, technology, and the personnel. And we're kind of trying to approach it from all angles. Personnel you never mentioned, but that one is huge because we have a global shortage of healthcare professionals. But on the equipment side, we're exploring now the approach to leasing as opposed to purchase. Because what we have found is that a big part of the use of the equipment is maintenance. And unfortunately, we don't have the capacity. The first time the equipment breaks down, it ends up in a corner somewhere. And sometimes, even when you have extended services, you have to send to Germany for the person to fly to Jamaica, and it just creates all sorts of problems. So we're trying to standardize the arrangements. If we're leasing mammograms, for example, or CT scans, we lease with a contract for servicing, and they are responsible for either being mobilized here or training the skill sets to be mobilized for servicing, so we get the optimal usage out of it. And many countries do it, so it's something we're looking at.
Thank you very much.
The minister spoke to technology, but I would want to hear even from the president of the Medical Doctors Association, because a lot of doctors now are doing telemedicine, and that will change the game, especially for people who can't afford transportation. And I don't know if the president can.
Certainly. I believe that the move towards increasing the electronic health record is a wonderful one, and it's actually going to save the environment for one. It's going to actually save a lot of money on a lot of. We're talking about health funding. This is somewhere that we're actually going to be able to move funding from into actual service provision. Equipment is a huge problem, and the mechanism that the minister just spoke about in terms of getting leasing arrangements instead of purchase arrangements, I think it's worth pursuing. However, there are some areas of equipment maintenance and so on which are not amenable to that at all. So what I think is worth pursuing as well is improving not only the numbers and the funding for the biomedical departments in the hospital, but their overall organization. There is a huge problem with that. our biomed unit, I call it purgatory, because all of our machines just go there after they've died to wait to see whether they're going to heaven.